So how do you explain heart attack to young students?
Heart is the only organ in the body which works 24 into 7. If it stops for 1 minute, means patient dies.
So what kind of cases do you receive or do you deal with, and which one was the toughest for you?
Number one, I diagnose the hypertension, I treat the hypertension, I make them the patient is within the goal.
So is there any way to get to know like if is there any blockage in our heart or not, like in advance only?
No, absolutely no. There are first we have to identify what are the risk factors.
So since you are an amazing faculty with DMHCA, so I would like to know how do you guide DMHCA student or how you teach them?
Suppose patient comes to you, first and foremost is a proper history taking, then proper examination to the patient. By looking at the ECG is secondary, but looking at the pulse is primary.
Okay, so like what is the difference between working in hospital or in a private clinic? How much a cardiologist can earn in 1 month? If you could just share one story, maybe one of the most emotional or memorable heart attack cases you handle in your life. Hello everyone, welcome to a brand new episode of Mentor Talks by DMHCA. Today's guest is someone truly special, Dr. Ravi Shanker, at leading Interventional Cardiology with over 21 years of experience. He is the HOD and senior consultant at Esther Prime Hospital, Hyderabad, and has performed 10,000 plus cath lab procedures. He is a fellow of American College of Cardiology and the European Society of Cardiology and has made significant contribution to research with multiple publications and 2 authored books also. Today's session is not just about heart attack, it's about heart health, lifestyle, medicine, and even for clinical insight and the transformative journey of becoming a cardiologist. So hello doctor.
Hi.
First of all, thank you so much for giving us your time.
Thank
you
you
came
so
here,
much
we are
for
very
your
glad.
kind words, please.
Okay, sure. So first thing first, doctor, when did you first feel drawn to cardiology?
See, before that, I have applied for the engineering first.
Okay.
Because my whole family is academic family. My brother is an IIT engineer, so everybody told me, no, you have to do medical. So I have prepared for the medical, and I am very die-hard workaholic.
Okay.
And I stood state third rank.
Okay.
State third rank in medical. Then after my MBBS, my dream was to do the MD medicine at any cost. First attempt, I got All India 16th rank, and I have chosen, I got every branch, but my clear cut focus is absolutely MD medication. After MD medicine, I have cracked even the UPSC, I have cracked all the TCS and NMDC, NTPC, everything. Then I met with a big cardiologist.
Okay.
He came to one of the hospital where I have worked for only for 15-20 days. The amount of what the intervention they are doing, he has just presented a CME. Then I was really inspired. The only thing is, cardiology is the only branch where you will get professional satisfaction.
Yeah.
Just now I did a angioplasty where patient is hardly 36 years, came with severe chest pain, BP is 90, and I did the angioplasty, and now within half an hour patient is absolutely all right, about to die, and I have saved. That is what the professional satisfaction is I am getting in cardiology. That's what I thought. Actually, I will get more intervention or more acute cases. So I thought I will join cardiology.
That's nice. So how do you explain heart attack to young students?
See, heart is the only organ in the body which works 24 into 7. If it stops for 1 minute, means patient died. So for this working, you need some oxygen supply, blood supply or something. You have a motor in your house, pump होता है, For that you need electricity or diesel. Like that, heart needs some blood supply. So blood supply is having 3, 2 in the left side, 1 in the right side. These arteries will carry blood to the heart so that heart will pump. If any block in these arteries, then we'll call is a heart attack.
Heart attack. Okay.
There is 3 arteries are there. If any blocks in the artery, that means supply to the heart is blocked.
Okay. So
So that is any block in the coronary artery is a heart attack.
Okay. So is there any way to get to know, like, if is there any blockage in our heart or not, like in advance only?
No, absolutely no. There are, first we have to identify what are the risk factor. Now a traditional risk factor is BP, sugar, cholesterol.
Cholesterol.
Other than that, we have a traditional like family history and any genetic factor. Now the non-traditional also, like mental stress,
Mental stress.
sedentary lifestyle, those who are not doing proper exercise, unhealthy diet. So many now youngsters are addicted to junk foods.
Yeah, true.
Now if you see about any house, Swiggy, Zomato, 100% it will come every alternate day. Now it comes as 10 minutes idli, 10 minutes tiffin. So these are all processed food, which is really bad. So I am coming to this, if those who are having a risk factor, if they are having any chest pain or breathlessness or any symptoms of heart attack like chest pain, breathlessness or palpitation or fatigability or some pedal edema or something, you better consult a cardiologist, nearby cardiologist. Okay. So there are symptoms will be there before you get the heart attack. And one more thing I just want to tell, any patient is having a heart attack, it will not come overnight. See, the process of atherosclerosis will be there for last 5 to 6 years, more than that. Slowly it will progress. Then patient will have sudden heart attack. So a person is doing a proper diet control, proper exercise, proper sleep, less stress at least, and control BP, sugar, cholesterol. These patients are very less chances to get heart attack. Okay, and my advice, if somebody is having 20, 25 plus, at least get it one master checkup at least once in a 2 years.
Okay, so could you please elaborate the master checkup?
See, you have asked these person we can identify or not. Some patient is having some ECG problem or echo problem or TMT problem. So these are the very important, echo, ECG, TMT, which is a basic things. If you have something, that means you have diagnosed before getting a patient with major heart attack. You have diagnosed here. So there are few blood tests are available and some investigations like ECG, echo. So where you can get to know that patient will in the downtrend after 1 year or after 6 months, patient will develop heart attack or not. So by 70% or 80% block, yes, 100% block means major heart attack. So before 100%, 70%, 80% also will come to know by few tests.
Okay. That's great. So since we were talking about youngster, so what is the most fascinating aspect of the heart that every student should understand?
The fascinating, which I have told, heart is the only organ which has to work 24/7. If it stops, no. So please take care of your heart. If you don't take care of your heart, you are gone. So if you are not taking care, either life is gone, or if you survive also, patient will land into chest pain, and if you do even a stenting also, sometimes patient will have breathlessness. So it is better, prevention is always better than cure.
Yeah, sure. So I'm sure there will be many MBBS doctors who must be watching this episode. So if you could just guide them, like who wants to become cardiologist, if you have to guide them how they can achieve their goal or how DMHCA will help them, that would be great.
most important is the patient, the doctor's attitude. If they want to serve the humanity, cardiology is the best. First is MBBS is a very noble profession. So now so much of competition about the cardiology, MD, then DM, you may not get. I am associated with DMHCA almost for a couple of years, more than 3-4 years also. I've seen they are doing good job in spite of, suppose a student didn't got even a DM cardiology. If he want to learn about the cardiology, it's not that you can learn, because you can save a life.
Yeah.
That's what for the humanity ground. You want to serve to the community. You can save a patient. No need to have a DM cardiologist. Yes, somebody has collapsed in front of you. If you know how to do a proper CPR, for that you don't have to DM degree. So you can learn it. In that way, which you have asked the question, how DMHCA helpful, these DMHCA, they will give some platform to the MBBS student who are qualified MBBS student to acquire so much of clinical knowledge. So the clinical knowledge is very important. Degree is not important. If you have a degree without knowledge, it's of no use. So this DMHA, which they have associated with few of the important hospital and few of the important doctors who are academically interested, these people, they will guide to the students and the young doctors to have a good clinical knowledge. If the doctor is trained with a clinical knowledge, 100% he is good to the society.
Yeah. Since we are talking about youngster and their career, so what are the academic steps after MBBS for cardiologists?
Getting passed by MBBS is a big task. So 5.5 years. After that, nowadays everybody has to do a MD degree or MS degree. So that is what we call post-graduation. So post-graduation, after that, if the student want to do a super-specialization, again they have to do 3 years of super-specialization. Life never ends there.
Yeah.
After super-specialization also, you can do so many fellowship course like electrophysiology or interventional cardiology or some fellowship. My understanding is very clear. My motto is very clear. Each and every step of your life, you have to learn.
True.
Don't count your age. I am 30 plus. I don't want to learn. No, then life stops there. So I am right now, whatever I am, 40 plus or 50, 45 plus or 50 plus also, I want to learn new things. I want to acquire new knowledge.
Yeah.
If the doctor, young doctor, they are passionate, 100%, even DMHA can guide them to acquire more clinical knowledge. That is very important, since most of the time I have seen so many medical colleges, no teaching, no clinical experience. But I have seen few of the doctors from DMHA, they are doing extremely good.
Okay, so now let's talk about your journey. Like, how was it? Is there any moment which tested your patience or anything?
So many times I even thought that why I have chosen medical. It's a lengthy process. So my brother is an engineer. He has started earning at the age of 23, 24. I have started earning by 28, 29, something like that. So it's a lengthy process. Every step, you have to prove yourself that you are the best. Every patient is different. Every disease is different. A heart attack comes to X, heart attack comes to Y is different. Heart attack is the same, but different presentation, different, everything is different. So COVID, you came across COVID.
Yeah.
You got the COVID and another gentleman got the COVID. Both are different. So it is not the same. So each patient we have to treat like a disease. We have to deal with the whole body as a disease. But ultimately when I have gone through the disease and I have treated, and the end of the day, patient smiling and going in a discharge, that is giving me a beautiful experience. Yes, that is what the professional satisfaction which nobody can get in an engineer, even an IAS officer or a minister,
Yeah.
anybody won't get that much of satisfaction. Patient about to die, going on discharge in a smiling face, that's a ultimate satisfaction. That will wash away all my depression on all these things.
Okay, so since you have mentioned heart diseases, so what kind of cases do you receive or do you deal with, and which one was the toughest for you?
A basic heart disease like hypertension, very, very important. First, number one, I treat the hypertension. I diagnose the hypertension, I treat the hypertension, I make them the patient is within the goal. So 3 points are very important. Patient has to. Second is diabetic cardiomyopathies. Third is heart attacks. So acute coronary syndrome, you have to deal with very, very, very patiently, and technical skill is very important for a primary angioplasty. Not only heart attack, I treat with all the complete heart blocks, arrhythmias, I put the pacemakers, AICD, CRTDs, and valvular heart disease like PBMB. TAVR is a new technique which we are doing regularly, and now mitral valve also, TMVR also we are doing. Other than that, all imaging, cardiology also we are doing, and the students also exposed to that imaging cardiology, IVAS, OCT, and most complex angioplastics like CTO, bifurcation stenting, SVG stenting also we are doing. So in other than that, the small kids, they are having some holes.
Some holes.
Now without operation also we are doing the umbrella closure. So
Okay.
device closure we are doing. So all range from the starting from the kids to adult to the old age, TAVR, all range we are doing. And I told you, I just want, my appetite of learning is more.
More.
So I want to learn more day by day. So I am a national faculty for the whole cardiology.
Yeah.
So I attend all the conferences. I acquire knowledge. In that, patients are benefited for that.
Okay, so since you are an amazing faculty with DMHCA, so I would like to know, how do you guide DMHCA student, or how you teach them?
First and foremost thing is a clinical knowledge. Now most of the students which I saw that they are not having that clinical knowledge. The human touch is very important. Suppose patient comes to you, first and foremost is a proper history taking, then proper examination to the patient. By looking at the ECG is secondary, but looking at the pulse is primary. So now patient comes, they are not touching, the youngsters, they are not touching the patient, not seeing the BP, not seeing the pulse. That is what I teach them, guide them. You have to go by protocol based, stepwise approach. Stepwise approach, protocol based. If you learn the stepwise approach and protocol based, 100% at the end of 1 year or 2 years of the course, a student will go in a very flying color. And I am sure that this is a clinical approach. So clinical cardiology, they will have a good experience, hands-on experience, and good clinical knowledge. So if you have a clinical knowledge and hands-on experience, at the end of the day, after 1 year or 2 years, you will definitely diagnose a patient and treat a patient. That's what we want.
Okay, so I feel, since you are very successful cardiologist, so is there any one book, tool, or habit that helped you to during your journey?
A book is not there, but I personally, what is how I am making so much of energetic is a proper discipline is required.
Yeah.
A doctor or a person, any person is a proper discipline, he will definitely will be successful in his life. The proper discipline, I wake up at 5:30 and I do some gym or badminton, which is a very important in my life. At least do some sort of exercise.
Yeah.
At least 1.5 hour badminton. I play a badminton a lot. So 5:30 to 7:30 maybe. So 7 o'clock, at least 1.5 hour I play. That will give a good physical fitness and mental relaxation. So that is a very important. Any person, a proper disciplined life and some sort of at least 1 hour per day you have to do some exercise. Not only physically, mentally also you will be balanced.
Okay. So like what is the difference between working in hospital or in a private clinic?
Absolutely nothing. Hospitals, if you are in a corporate hospital, it may be something like target oriented, but I have never felt any sort of, I don't want to join a hospital where they will give the targets. Of course, hospitals are very, very happy because so many patients are coming for me, and clinic is you are the boss.
Yeah.
Whenever you want, you can come. Whenever you want, you can go. So many pros and cons are there. Clinic, you cannot treat the patient with acute MI. Again, you have to depend upon some hospital. If you want to cross consultation, suppose if you have a patient with a heart attack with a kidney problem, you in the clinic you cannot. In the hospital you can call a nephrologist or a neurologist or a diabetologist. So hospital setup is always better for a cardiology practice. OP, yes, some clinic, but clinic you have so many limitations. Investigation, all investigation you cannot do, and all treatment also you cannot do. So OP basis clinic, but hospital is absolutely required in emergency like cardiology.
Yeah, because you have so many facilities.
Yes, absolutely required. Because round the clock sisters are required, round the clock nursing staff is required, duty doctors are required. So all these things possible only with the monitoring to the patient, everything possible with hospital.
Okay, so since we are talking about cardiologists, let's ask you a fun and real question and be honest. Like how much a cardiologist can earn in 1 month?
Absolutely a tricky question. Just few hours back I was talking this to my colleague who is a DM cardiologist. So the cardiologist nowadays, number of cardiologists also very, very high. So a basic DM cardiologist fresher can earn something around 2.5 to 3 lakhs.
Okay.
A experienced and a good clinical skill cardiologist can earn up to 15 to 20 lakhs per month.
Wow, that's a good number.
Starting from 2.2 to 2.5 to 3.5 to 15 lakhs, easily they can earn.
Okay, so since you have mentioned the income a cardiologist can earn, so how long does it generally take for a cardiologist to become financially stable?
This is absolutely depend upon the person to person.
Okay.
If a person is very, very good in the clinical skills and communication skill and the treatment diagnosing part, so in that case he can get it at least a minimum of 7 to 8 lakhs within 5 years.
Within 5.
If the patient, 3 things is important: proper diagnosis, proper treatment and proper clinical skills. If you 3 things are there, 100% you can get it.
Okay, so since DMHCA provides so many courses, so I have another question related to that only. So are there any international opportunities or fellowship that's open once you specialize in cardiology?
Yes, once you have done your cardiology, you can do the fellowship in interventional cardiology, fellowship in electrophysiologist also. So there are few fellowship courses also there where if student want to learn, there are so many courses are there. One is which I have told, these 2 we are managing. Fellowship in intervention cardiologist. I am getting so many international students also from different countries, from even Gulf and South Africa also we are getting. So the students, the doctors, they come here, they learn hands-on training also they will get, and they are very happy for that.
Okay, so now let's go real for a minute, as you are very experienced and you must have handled so many cases. So if you could just share one story, maybe one of the most emotional or memorable heart attack cases you handle in your life. So
there are 2 sides of the story. One is a bad story, one is a good story. So I don't want to tell only good stories. There are so many bad stories also there. Honestly, I just want to reveal few. I was a very successful doctor from Karimnagar onwards, and so many patients, they blindly believes me. I know that. Like that, I just want to tell one bad story first. A patient came hardly 32 years, obesity, and a patient relatives, distant relatives, I have treated very severe heart attack, about to die. They told you go to Sai Ravi Shankar. They are very scared. उनका हाथ में सफा है. That's what they feel. So they came here, they treated absolutely. That person has sent that person 30 years male. He came to me with a chest pain. I have done ECG, I have done echocardiography, I have done tropi also. All three are normal. I told nothing to worry. You are not a diabetic also. Nothing to worry. Because your ECG normal, echo normal, tropi normal. So nothing to worry. You go and relax. I have written some test. I have told also we have taken second ECG. Second ECG also normal.
Okay.
So we normally any chest pain, if the patient is a typical anginal pain, we take 2 ECGs. Okay. So the patient gone. After that, he was very happy. Dr. Ravi Shanker has told nothing. I don't have any heart attack. Then he has gone to movie in the first show, 6 to 9. After 9 o'clock, patient had a dinner outside. And after that, patient came home. At midnight, the patient developed some chest pain. He thought, I have taken dinner outside, chest pain maybe because of acidity. Didn't came here. I have told very clearly, if you have any chest pain, didn't came here. And he has not told to any of this, his wife also. 5 o'clock, patient expired. A young patient. So that is what the bad part of my, because he has trusted me.
Yeah.
Something I don't know what to do. Second part is, yes, a patient came with very referred 2-3 hospital, rejected with the inferior MI, with complete heart block, BP not recordable, young lady actually, and I took it very challenging. And I have done it with ventilator support. I have taken the BP is not recordable, still not adrenaline, taken to cath lab, immediately opened. Within 3-4 days, patient is absolutely all right.
All right.
So it's something like miracle. So this is a very good part of my story. So there are so many good part of the story. So we have to, each patient I learn something. From the bad also, it's some lessons I have to. From the good also, I have to learn so many lessons. So I acquired, if it is a bad also, I learn some lessons.
Something. So how do you handle or deal with these moments? Like you have to break tough news to their families. So how do you handle actually?
We will sensitize the patient attendants, and if the patient is BP is not recordable, patient is then we will tell them very emotionally. We will tell them we are trying our best. If it is anything possible, we are trying whatever the maximum possible. We'll try, and if it is not succeed, we cannot. We are not the gods. We are only the doctors who can treat our patients. Even 1 or 2% of the patients out of 100, 2-3% also they made. If they are in a very all critical condition where multi-organ failures are there, we cannot. We explain to them, and most of them they understand.
Okay, so now let's come to a fun part. We have a segment called Dil Se Poocho. So my first question is, what food do you personally avoid to keep your heart healthy?
Fruit?
Any food.
Food?
Yeah.
I don't like outside food. Mainly junk foods like the pizzas, which I don't like.
Yeah.
So these burgers, pizzas, I avoid them. Number 2, most important I avoid is the, after you are going to a dinner, desserts.
Okay.
आप किसी के शादी के जाते हैं, desserts, which I avoid that. Third thing is I avoid finger chips.
Okay.
These 3, finger chips have so much of calories. And the ice creams, all these desserts, ice creams, I am talking about purely ice creams and sweets. So I avoid it. These three things I usually avoid.
Okay, so one heart myth people still believe.
If you ask me very, very clear, taking alcohol is bad for the heart? No. Even taking alcohol, sometimes in a cardiomyopathy, taking red wines is good. It's a myth that. But smoking is very dangerous, yes. A limited amount of alcohol once in a month is not a bad choice. You can take.
Okay, so one Bollywood song you would dedicate to human heart, if you can. Any Bollywood song.
Oh, it's very difficult at this time, but I will try my best. Dil Chahta Hai.
Okay.
Yeah, that song is really good.
Yeah. Okay, so if not a doctor, what would you be?
I just dreamt if I am not a doctor, I will be a politician or MP, MLA by this time. 100%.
Oh, okay. Okay, so my last question is your go-to stress reliever after a long day at hospital.
Yeah, that's you have to maintain a discipline in the timings also. The discipline in the life means I never take that much of stress. 8 plus 8 plus 8 is a formula. Always maintain, plus or minus हो जाता है. 8 hours I take sleep and 8 hours for my personal life and pay 8 hours. So professionally maybe 10 hours or 12, but sleep I maintain 7 to 8 hours.
7 to 8.
And which important is you should have a proper friend circle, a positive mentality friend.
Positive, yeah.
That will give you some mental stress reliever. So I have a group of friends.
Okay.
And badminton friends also there. I have a group of friends which I maintain them, and if at all any stress also, I go them and burst myself this, and they will also, they are very good in positions also, but so you should have a friend to whom you can even, either your family member also can be a good friend.
Yeah.
So you have to share.
So before we wrap up, what is one message you would like every listener to remember when it comes to heart health?
Discipline, discipline, discipline. In the life, you should have a discipline. Whatever you are taking food, think once, whether it is a healthy or unhealthy. Whether you are doing 24 into 7 into screen, the screen time nowadays is very, very, very high. Do some sort of exercise. So proper diet and exercise is a very important for any healthy heart. And third thing, reduce your stress. You are not going to take so much of bugs into your, don't take all the burdens to your head. Reduce your stress. Take proper sleep, at least 7 to 8 hours of proper sleep. Smoking is very dangerous to the heart. These are the few things, if you manage, I am sure that 50% of your heart attack you can reduce in your hand. Thank you.
Yeah.
If you share, your burden will come down.
Okay. Thank you so much, doctor. And not just for your time, you have shared so many things with us, your experience and very deepful insights with us. Thank you so much.
Thank you. All the best, DMHCA.
Thank you. And to all doctor listeners, if you are dreaming to become a cardiologist or want to grow in this field, visit our website dmhca.in and apply now in fellowship, PG diploma or even for certificate. And don't forget to follow us on Facebook, Insta or even on YouTube. We will see you in next episode with more insight, more stories, more inspiration. Until then, keep learning, keep growing and prioritize your career.